Good afternoon, everyone. This is Troy with Ohio Men's Health here in Columbus, Ohio. Hey, if you've been watching our video series, of course, we've been trying to put out a bunch of information for everybody so you can just get familiar with testosterone replacement therapy, Ohio Men's Health. What is it? What do we do? What is Men's Health? So if you haven't subscribed to our YouTube channel, hit the subscribe button. Go to Facebook, hit TikTok. You'll find tons of information. You can find us online by looking at this website. You can go to columbuslowt.com. Again, that's www.columbuslowt.com. You can call or text directly for an initial consultation, 330-662-1030. Now today, we're gonna talk about just some expectations. A lot of guys, when they first start testosterone replacement therapy, kind of go for the first 4 or 5 weeks, they're like, really, I feel hungry, but I really don't see a big difference. And my biggest advice is going to be a few things that we're going to talk about today. What do we do when we first start testosterone replacement therapy, and what kind of expectations should we have? Because this is our number one question when people come in, and a lot of folks think, hey, first injection or two, it's going to be the sun, moon, and stars, and we're just over the moon, everything's better. And quite frankly, the biggest thing, my number one advice first, when it comes to testosterone replacement therapy and you're just getting started, is be patient. This takes time. This takes time to see results. This takes time to see the body comp changes, and it takes hard work. If you remember the 4 pillars of health that we talked about previously, we got to balance hormones, we got to think about nutrition, we got to get exercise right, and we got to sleep. But these things take time. So my suggestion is give it time. That's the first thing. And my first bit of advice when it comes to just starting testosterone replacement therapy is be patient. That's number one. Be patient. Number two, and I'll be working with you on this, I'm one of the providers here at Ohio Men's Health, is we have to figure out the injection frequency. Now, what we see with a lot of men, especially a lot of men that come from other clinics, is they might be taking a big dose once a week. And a big dose of testosterone, sometimes it's dosed too high. Like a lot of the clinics will just throw 1 ml at you weekly, and you go, gosh, I'm gaining weight, I'm hungry all the time, my body comp's not changing. And what we see is sometimes when we get this big bolus or this big injection of testosterone, we see a lot of aromatization over to estrogen or estradiol, and that can make you gain weight. And a lot of guys see that early on, that they just go, gosh, I'm just hungry all the time when I gain weight. Yeah, and sometimes we need to adjust that injection frequency where perhaps we're getting smaller doses, but more frequently. And it's different for everybody. Some people can go on that once a week frequency, but some can't. And everybody is different. So that's number two, is we need to figure out the injection frequency. And that's not something that's just gonna come overnight. So we need to really sort out what's gonna work best for you. What's the injection frequency? What kind of estrogen blocker do we need? And most men oftentimes need some type of estrogen blockade. So that's number two. My second bit of advice is we need to work on the frequency. What's gonna work best? Once a week, twice a week? There's some clinics that are even microdosing on a daily basis. I think that's a little bit much, but typically it's just trying to figure out what's the injection dose and the frequency. So that's advice number two, is we need to figure out what's the right frequency for you. And again, that will take, number one, time. Like we talked about, be patient. We need to figure that out for you. Now, number three is gonna be frequent lab work. So we need to follow closely with lab work early on. Typically, I'm checking labs once every 6 weeks to start, and then down to every 3 months until we get things dialed in correctly. And this can take 3 to 6 months to really begin to quote unquote hit the sweet spot and get you feeling well. So that's number three advice, is frequent lab tests, so we can really see where are things and begin to dial things in and get you where you need to be. So number one is time. Number two is the correct frequency of injections and the estrogen blockers or aromatase inhibitors. Number three is follow closely with labs. And number four, and this is the biggest thing I ask for all of our patients in Ohio Men's Health, is we need good communication. So whether it's by text, this number that I put out, I text well on this, frequent visits, emails, we need good communication. The more I know about what's going on, the better I can help. So these are the 4 things that you really need to be successful with testosterone replacement therapy. And again, in review, first, we need your patience. This takes time. And if anybody promises this is gonna just happen overnight, that might set you up for a little bit of failure and frustration. So number one, time and patience. Number 2, injection and the aromatase inhibitor frequency. We need to figure that out for you. It's very different for everybody. Number 3 is frequent lab work. We have to look at things very frequently. Number 4, good communication. And again, we have very, very open lines of communication, whether it's emails, texts, phone calls. We can normally get back to these things within minutes. If you have questions or if you need a phone call, this is not difficult for us to do. See, these are the 4 things in my best bit of advice for you when you first start replacement therapy. I'm 50. I started replacement therapy at the age of 40, and this is my personal anecdote, is this took time. It took time and a lot of hard work. I've always been a hard worker in the gym, but this took time, learning my body, what works, and that changed over time. I used to be a once a week injector. I'm up to twice a week now personally for the best results for me to feel good. When I do that once a week injection, I can feel the second day this big bolus or this big aromatization over the estrogen, and I can just tell it doesn't work for me anymore. It did previously, but it just doesn't anymore. So things can change with time. So in review, last bit of review for today's video, number 1, patience. Number 2 is injection and aromatase inhibitor frequency. Number 3, frequent lab work. Number 4, good communication. Guys, this will set you up for success. We'd love to meet with you. We offer a true free consultation. You can come in, we chat with you for an hour, get your history. We can draw blood, costs you nothing to draw blood. We'll send it to your insurance. It's typically covered extremely well. We'll meet with you a second round about a week or 10 days later, review your lab work with you, make suggestions. And if you decide to do nothing, that's okay. It still costs you nothing. It's okay. At least you understand and you know. So we'd be happy to meet with you. You can go to columbuslowt.com or you can call or text 330-662-1030. We'll see you next time.